Hey, it's Jamie from the MTBC. So today we're just talking a little bit about if you were to have somebody collapse in your clinic and you ended up having to do CPR on them. So we'll just run through the basic steps of how you're going to do that. So if you're to come back into your treatment room and somebody was just laying on the floor, the first thing you want to do is check their ABCs, which stands for airway, breathing, and circulation. So the easiest way to do that is we get down over top the person and we do what we call look, listen, and feel for 15 seconds. So in order to do that, you put your hand on the person's chest and then you put your ear right beside their mouth just to see if they're breathing. So just to see what that would look like. You would get down just like this. And you do that for 15 seconds just to see if you can feel the breath on your ear and to see if the chest is rising. Now if neither of those things are happening, you want to tilt the head back. And you do that by putting a hand on the forehead and then 2 fingers underneath the angle of the jaw and actually tilt the head back. And when you do that, it's enough to usually open the airway up. And then you would listen again. And if still nothing is happening, then you try to give 2 breaths. To see if air goes in. And in this case, we'll see the air did go in, as you can see the chest rise. So now that you know you've got an airway, you've just done 2 breaths for them. You need to get into doing your compressions. So to do that, you landmark at the opposite armpit, come up onto the sternum, and then you do your compressions. And 29, 30. And then you give them the breaths again. So you're always going to do it as 30 compressions to 2 breaths. And you just keep doing that until either the person wakes up or more help arrives. But you also want to designate somebody to call 911 for you and also get an AED if there's one available. So as soon as you know that the person's not breathing, that's when you designate somebody to call for it.